Welcome to the Wellness Protocol, your source for guidance on metabolic health, hormones, and longevity. I'm Dr. Alessia Roehnelt, double board certified endocrinologist, and on each episode, I'll share simple tools rooted in science and experience to help you feel better, live longer, and take control of your health. Hi, friends, and welcome back to the Wellness Protocol. Today, we are going to be diving into a topic that is starting to make some waves outside of the gym world, and for good reason. Today, we're talking about creatine. This episode is going to be about the real science behind creatine and why it may be one of the most underappreciated supplements for women, especially over the age of 35. We'll talk about how it can support not just your muscles, but your brain, your mood, and your metabolism, maybe even longevity. So whether you're trying to preserve muscle mass, stay as sharp as you can as you age, or just try to improve recovery from your workouts, you're going to want to hear this episode. So let's begin with what is creatine? Creatine is a naturally occurring compound. So our bodies actually make it from amino acids like arginine, glycine, and methionine. And about 95% of it is stored in our skeletal muscle. And the rest is stored in brain, liver, and the kidneys. The main role of creatine is to help your cells produce energy, particularly during short bursts of intense activity. So think about things like sprinting, lifting weights, climbing the stairs quickly, reacting to one of your kids screaming down the hall. That's when your body calls on creatine phosphate to regenerate something called ATP. That's the energy currency of your cells. While creatine is found in red meat and fish, the amounts are actually relatively small, and you'd need to eat over a pound of steak a day to get the typical supplemental dose. Now, of course, that's a lot of meat to eat every single day, and most people are not interested in that. So that's why supplementation can be very powerful, especially for people who don't eat any meat at all. But even for those who eat a moderate amount of animal protein throughout the week, it can become even more important as we age because our ability to synthesize our own creatine and store it actually does decline as we get older. So let's talk about why this matters for women, particularly in midlife. Creatine has been long studied in the context of athletic performance. But in just about the last decade, the research has expanded into areas that are much more relevant for aging women. First, muscle preservation. After age 30, we start to lose a lot of muscle mass, about 3 to 8% per decade. And unfortunately, that rate of decline accelerates around the time of menopause and after menopause due to the decline in estrogen. So creatine helps to counteract that muscle loss, especially when you pair it with something like resistance training. It can increase strength, improve muscle fiber quality, and support better recovery. Now again, this is in addition to strength training. Don't get the idea that if you just buy a creatine supplement and start taking it, that you are going to automatically wake up in the morning with more muscle mass. This is just a tool for your body to help build muscle as you are doing more strength training and resistance training. But more than just muscles, let's talk about why creatine can also be important for brain health. So creatine is used by the brain for energy. And studies have actually shown that there are some benefits in terms of cognition, your working memory, even potentially your mood, especially when you're under conditions of stress or sleep deprivation. And unfortunately, a lot of us fall into those categories. And there's even early research showing potential benefit for depression, particularly in women. One small study found that women with major depressive disorder who added creatine to their SSRI, that's something like Zoloft, Lexapro, those women saw faster and greater improvement in their symptoms. Then, of course, there is the metabolic health improvements. So creatine may improve glucose tolerance, which could potentially help fight insulin resistance. It could also potentially help mitochondrial function and support better energy metabolism at the cellular level. That's huge for people dealing with fatigue, insulin resistance, or maybe even just a predisposition to getting diabetes, like a strong family history. This could potentially be beneficial for, again, people who do intense workouts and they have difficulty recovering from those workouts. And there's even a growing body of evidence to suggest that creatine may also benefit bone density and body composition, particularly in postmenopausal women. So now that we know creatine is not just for young guys in the gym, let's talk about how to take creatine safely and effectively. Now, of course, anytime you start a new supplement, you should always check with your doctor, because while this is generalized education, everybody's body is different, and you really need that personalized touch to know if something like this is going to be safe or effective for your body in particular. But when we talk about creatine supplementation, generally the standard dose is about 3 to 5 grams per day. Now, most people, especially women, don't need to do a loading dose. That is kind of an old school method of taking a large amount in the first 5 to 7 days. You definitely can skip that component of this. But a consistent low daily dose can actually work very well. And by doing it in smaller doses, you can reduce the risk of some side effects like bloating. Creatine technically could be taken at any time of day, but usually pairing it with some kind of carbohydrate or protein-containing meal may actually help take up the creatine into your muscles. But really, when it comes to most supplements, the idea is try to take it when you can remember it. This is not one of those supplements that needs to be taken in a very specific way with specific types of foods. It doesn't necessarily need to be spread out from certain types of foods. So really, you could take it at any time of day, but I would advise taking it with some sort of food. That'll probably make it a little easier on your stomach and absorbed a little bit better. But one very important point to know about creatine is that you need to stay hydrated if you start a supplement like this. Creatine can pull water into your muscle cells, which is a good thing, but you need to be drinking enough water to get that benefit and to support that shift. So remember, ideally, you should be drinking at least half of your body weight in ounces of water per day. So if you are not drinking enough water, please start there. Add supplements later. Some people ask if you need to cycle creatine, meaning take it for a period of time, then stop taking it, take it again. You actually don't need to cycle it. You can take it long term. It's been studied for a while, and it is considered one of the safest supplements on the market and safest supplements to take. Though again, always check with your doctor for your specific body requirements. One thing I would also caution you on is not all supplements, products, companies are the same. So it is very important that when you are choosing your supplements, you go with a very high quality product. Always check the back label. You want to see what other ingredients are in your supplement. You are trying to be healthier. You are not trying to get in more toxic foods than you thought you were eating. So try to look for vitamins that don't have a lot of fillers, that don't have a lot of dyes, artificial sweeteners, natural flavors, any type of chemicals that could be taking away from this supplement that you are trying to take to support better health. So always look at the label on the back, go right to the inactive ingredients and take a look at what's in there. If you've never heard of an ingredient, probably not the greatest thing for you. If you're not sure, just do a quick Google search or again, ask your doctor because you want to know exactly what you're putting in your body. While the active ingredient is what you're buying, is what you're interested in, you always need to see what else is in that product that you're getting. Now, when buying creatine, you want to try to get one that's called creatine monohydrate. This one is the most studied, seems to be the most effective, and actually is the most affordable form. There are some fancier versions like creatine HCl or buffered creatine. They don't necessarily offer better results in people and actually can just be higher in cost. You also want to look for brands that are third-party tested, like NSF certified or Informed Sport, especially if you're an athlete and you need to avoid things like contamination. So always try to pick something that has been third-party tested to make sure you are getting a pure and clean product. I would also caution you to avoid blends that mix creatine with things like caffeine, stimulants, sugary drinks like pre-workout drinks. Again, you're looking for a clean product. You are looking to add creatine without adding a bunch of extra junk that you didn't anticipate. So look for a product with one ingredient or as few ingredients as possible. And that one ingredient should probably be creatine monohydrate. Now, is creatine safe for everyone? As I said before, you need to check with your own doctor because while creatine is considered relatively safe for most people, there are a few patients that really should not take creatine. The biggest concern in the medical field that we worry about is in patients with significantly impaired kidney function or pre-existing kidney disease. They may be doing more harm than good if taking too much of a creatine supplement. For patients with very healthy, normal kidney function, there really is no solid evidence to support that it's harmful to the kidneys. But if you're known to have pre-existing kidney disease, or if you're not sure, you always need to check with your doctor first before starting a supplement like this one. Some other more common side effects would be bloating or water retention, especially in the first week when you start the supplement. Now, these side effects are usually temporary. They're much less likely if you're starting a low dose, like 3 to 5 grams per day, but that's something you might anticipate when you first are taking this kind of supplement. However, be reassured that creatine shouldn't cause weight gain in the form of fat. If you're having some kind of change in the scale and you feel like you're gaining weight, this actually might be from increased water in your muscles. And that's actually one of the ways that it's working and one of the ways that it's helping your muscles function better. Now, some people that I would really caution against taking creatine is if you're pregnant or breastfeeding, because in those categories, a lot of medications and supplements have just not been studied. So I generally never recommend supplements like this for women who are pregnant or breastfeeding. There are just too many question marks about it. But otherwise, for most people, creatine does seem to be a pretty safe supplement when taken in small amounts, especially when you are also drinking adequate water and utilizing that creatine by adding resistance training or strength training to build up muscle mass. I think that this is a reasonable supplement for people to take midlife, especially women over the age of 35, because we know that there is this huge decrease in muscle mass. We know it starts a few years before menopause, really worsens around the time of menopause and after menopause. And it is so important to try to combat that muscle loss with building back up muscle. Sometimes taking a supplement like creatine can just be a helpful tool when combined with exercise and a well-balanced diet to try to build back up that muscle. So if you've hit a plateau in your fitness regimen or you feel like your muscle recovery is getting worse and worse and slower, and you are really interested in preserving strength as you age, this might be a good tool to consider adding to your toolbox. So let's recap. In today's episode, we talked about how creatine is not just for men or for athletes, and it could be particularly useful in women over the age of 35 because it can support muscle strength, muscle building, brain function, and even metabolic health. Overall, it's pretty safe and effective, and there's been decades of research on this one. But a simple 3 to 5 grams every day is all you need. You do not need to go overboard with a supplement like this. More doesn't always equal better. And absolutely, quality matters. So make sure when you are buying a product, you are looking through everything, where it is sourced, the process they use to make it, which inactive ingredients are included, if the product is third-party tested, These are all very important things to know so that you can have a full understanding of what you're putting in your body. I do think this is a great supplement in addition to overall long-term healthy diet, healthy exercise regimen, especially for women trying to navigate perimenopause and menopause or any of those midlife shifts in your metabolism. If you found this episode helpful, please share it with a friend who's lifting weights, hitting a plateau, and just wants to age strong and smart. You can also DM me on Instagram at EndoHealthDoc. I'll be happy to send you a few creatine brands that I trust. And if you're new here, don't forget to follow or subscribe so you never miss an episode of the Wellness Protocol. Thanks for listening, and as always, stay strong, stay curious, and take care of yourself. See you next week.